Hey there, welcome to Tea Talk. So it's Tuesday as usual, and today on Tea Talk we're going to go over annual wellness visits, and I have a PDF to share with that, and some information from CMS. So, and a link. We actually went ahead and put it on our website now, so it's available for you to take a look at if you go to stalkinghorse.llc.com and you go under Tea Talk and then click on Tea Talk. You'll see an icon that has annual wellness visits. It's going to be on the bottom right hand side. If you click on that icon, you'll get the PDF that we're going to go over, and it has a link is the first page of the PDF for Medicare. So it'll take you right to the source document for the information that we're going to go over. I'm going to give a couple minutes. I know that tonight, I think some of the regulars are going to be out. So might have a shortened or less crowd, but let's see who's in tonight. Hello, Aline from Florida. And I know we've got Nick on. We might have I don't know if Ricky's going to be on tonight or not. Again, I know a couple people are out doing different things. It's summertime, so everybody's starting to get some vacations in and having some fun. So hopefully, too, I'll get one in this summer. We'll see. We'll see what happens. Oh, hi, Chantilly. Hello. Yes, from Florida. Got a lot of Floridians in the house. And again, if you're joining us from LinkedIn, I can't see if you join in through this stream. It's through StreamYard, so I can't tell. I can see your comments, but I can't tell if you've joined. So you'd have to put a comment in and let us know that you're here. So tonight, also, I'm actually not going to do tea tonight because I had some coffee earlier, and I don't have any of my decaffeinated tea here in the office. So I'm just going with some good old fashioned smart water, try to get some electrolytes in, and to not keep me up too late. If I drink too much caffeine late, I can't go to sleep. Sorry. So a lot of family will drink espresso at night, and I cannot do it. I cannot handle it. I'll be up all night long. But so we'll go ahead and get started here. I'm going to share my screen. So we'll kind of go back and forth. Remember that if you have questions, you can feel free to type in your question in the comments or in the chat box, and I will do my best to answer them during the session. Just remember, we are live. So if I don't know the answer, I'll get back to you guys like I normally do next week, or send a message, one of the two, depending on when you post it. And if this ends up giving you a question that you might have that would create maybe another actual Tea Talk, you can send it into teatalk@stalkinghorse.llc.com. You also have that option. So after the fact, you can email there. You could also even just on YouTube comment on YouTube itself, and I'll get that. But you can use the Tea Talk email. That's what it's there for. And remember to join the herd, like, subscribe, and follow us. So you can like and subscribe to the YouTube. If you like this video, it kind of upvotes it, allows people to know that you recommend it. And we are on Facebook and LinkedIn and Instagram also. So check us out there if you haven't already. So let's go ahead and jump in. I'm going to try to do this screen share, which sometimes is challenging. So let's see if we can get this to... There we go. All right. So this is the first page. This is the link, and this will take you straight to CMS's information for annual wellness visits. MLN Matters article. So it gives you full information about annual wellness visits. It's going to walk you through what's included, what's required. It's very, very, very helpful. But the whole purpose of Tea Talk is it's one thing to read it, then it's another thing to be able to discuss it and ask questions through. So I think that's always helpful for us to be able to have this platform to kind of talk about it. So let me see here. If we jump in, the first thing is, what is the annual wellness visit? Because there's a few different things that may come to mind. And so the actual annual wellness visit that we're going to go over today is this center item here. But that's not to be confused with Medicare's initial preventative physical exam, which has its own code here, or also the routine physical exam, or also known as a preventative medicine visit. So just in some layman's terms to explain that, there's a difference between when someone has a commercial insurance policy or Medicaid, let's say, versus Medicare. So Medicare, just for those who may not know, is if a person is either disabled or 65 years or older, they may qualify for Medicare. Medicaid is like low income, and then your commercial policies can either be you can either have one of those through a job or through the healthcare marketplace. Sometimes you can get a commercial policy that way, but a preventative medicine visit or an annual physical exam, that's for the commercial insurance plans, which includes a physical examination of your body areas and organ systems. And that's different from an annual wellness visit from Medicare, which is what we're going to focus on today. So I'm going to pull that document back up. So going from left to right, because that's how we typically read, I'm going to go ahead and make this a little bit bigger. So this initial preventative physical exam, we're going to start here, or IPPE is what it's called. There's a HCPCS code G0402. So that includes a review of a patient's medical and social health history and includes education about preventative services. So this is known as the Welcome to Medicare visit. It's performed only once in a lifetime for patients within the first 12 months after their Part B benefits eligibility date. So if someone has Medicare, they can have Medicare Part A that automatically comes, which covers hospital, inpatient stay, visits, or they can select the option to have Part B, which then requires a deductible to be paid. But Part B would include this initial preventative physical exam. And again, it's a once in a lifetime thing. So that's obviously different from the annual wellness visit, because the annual wellness visit is annual. So that's once a year, where the initial preventative physical exam is once in a lifetime. So that's the difference there. So the annual wellness visit, which is in the center here that we're going to focus on today, that's going to be either code G0438 or G0439. And these are HCPCS codes. They start with a letter. So they are HCPCS codes. So this is an annual review of a patient's personalized prevention plan of services and includes health risk assessments. So if it's the first annual wellness visit that they've ever received, so after this first time, this initial physical exam, and the next time they would get this annual wellness visit. So it's the first annual wellness visit after that first initial preventative visit. And any subsequent annual wellness would be the G0439. So the G0438 is the first time the annual wellness visit happens. So it's like essentially their second year into Medicare, and then third year and on would be G0439. And it's every 12 months. Now, with that being said, some patients have Medicare replacement policies. So they may have like a Blue Cross Blue Shield plan through Medicare, or an Aetna Medicare plan, or a Cigna Medicare, or Humana Medicare. So you would want to pay attention to what their plan is and what they allow. Sometimes it's the calendar year, it has to pass that date, or it's just as soon as the next year comes, they're eligible for that visit, like January 1st. So you just want to make sure you know what those rules are. And then last but not least on this document here, as I mentioned, there's also a routine physical exam, also known as the initial periodic comprehensive preventative medicine visit. So that's a span of codes. So let me just make this bigger over here. So that's a span of codes, either 99381 through 99397. So it's used to report an annual preventive medicine visit for infants, children, adolescents, and adults, so that are non-Medicare. So Medicare does not cover that service, and that would be 100% out of pocket if it was billed with one of those codes. And the codes are broken up by new versus established, and then also by age. So the initial comprehensive preventative medicine code, sorry about that, let me go back here. Those are listed here, and that's for new patients. And then for established, it's this range listed here. But again, that's not the focus. So essentially, one of the largest differences is that the non-Medicare code, it does include an actual physical examination by the physician, where an annual wellness visit does not include an actual physical examination. So if we go ahead and jump more into the annual wellness visit, these are the actual components that are included in the annual wellness, in that initial annual wellness. So performing a healthcare risk assessment, of course, we would need to know their medical and family history, establish current providers and suppliers list, going to get some routine measurements, any cognitive impairments that may be present. We're going to try to detect any of those, which also can be done through some risk assessments, or some other forms, some types of exams that are done that it's not physical exam, but just some testing. So review of patients' potential depression risk factors, functional ability, appropriate written screening schedule. We want to know patients' risk factors and conditions, and then provide personalized health advice and appropriate referrals as needed for education or preventative counseling services and programs. Advanced care planning may need to be provided at the patient's discretion. Review current opioid prescriptions. That was actually a newer requirement that got added on due to the opioid crisis that occurred and is still ongoing. So we also have screening for potential SUDS, social determinants of health, also risk assessment. So there's a lot of additional services and components that could be rolled into the annual wellness. Some of them can be separately billed. So that's also going to be important, because there may be an additional code that you can add on, but that is dependent on whether it's the initial preventative, so that G0438, versus that G0439 code, because there's certain things, those items that were listed are automatically included in that initial. And then for the subsequent, we've also got a list going here. We don't need to read through each and every one, but again, this is available on the website. You'll see that on there, so you can download this document. So because I mentioned that they don't actually perform a physical exam, you may find it interesting to know that more than just the doctor can perform an annual wellness visit. A physician's assistant can do it, a nurse practitioner can do it. That's not too surprising. Also, a clinical nurse specialist can do it, which is a little surprising. And then a medical professional, so including a health educator, registered dietitian, nutritional professional, or other licensed practitioner, or a team of such medical professionals working under the direct supervision of a physician. So that part is a bit surprising. So I know several places have some RNs that will go and perform most or all of the annual wellness visits, because a lot of it has to do with screenings and information and prevention. It's really a preventative service and helping the patient to stay on track with their healthcare and making sure that they are getting all the necessary screenings performed, and if something's needed, referring them to the right place to get that done. So shockingly, it really can be performed by another professional. So many practices have specific personnel that is set up to perform those services. Of course, you need to check your state scope of practice and all of that, and make sure that it is allowed in your state, because it could vary. So then we want to talk about, again, like, when do we use that G0438 versus that G0439? So the initial annual wellness, so that's for their first annual wellness after that initial physical exam was performed. So when the patient comes in for their first annual wellness visit, but they've been enrolled in Medicare for more than 12 months. So that's when you're going to use that code. Even if the initial physical exam was not billed, you can still use that if it's been more than 12 months. But it can only be billed once per lifetime. So again, this is another once per lifetime code. So after that, that's when you would drop into that G0439. So that would be used annually for beneficiaries who have already received that IPPE or that initial, the G0438, and they're coming in for further annual wellness visits. So it can be billed once every 12 months. So you do need to watch out. So when these codes are used within 12 months of a previous IPPE or annual wellness visit, Medicare will deny the claim with a message that indicates the patients reached their maximum benefit, or their benefit maximum, for that time period. So you do want to verify that patient's eligibility before submitting a claim to avoid denials. So many practices wonder, well, how do I check that eligibility? So depending on where you are, your Medicare administrative contractor will have some sort of online portal. Typically, that's where they want to push you. They want you to go online to verify that. So you would set your practice up with some sort of access. Down in Florida, it's something called Spot, where you'd sign up for access to it using, you have to fill out a form giving them the practice's information. And once that's approved, you can actually do a lot through those online portals. Otherwise, you can call. And when you call, you can follow the prompts to find out and get benefit information for the patient. And it is a good idea to check other specialties, or I should say, this isn't specialty limited. So it's if you're a primary care physician's practice, there is the potential that a specialty practice could actually bill for this. Sometimes we would see in the past that this code would be picked up by or used by OBGYN. So if for the female patients, if they went to go see their gynecologist, occasionally they would bill for it. Most of the time it really wasn't appropriate. I just think that specialty wasn't really aware that what's supposed to be included in that. So because typically this code would be used by primary care, internal medicine. So the patient's primary care physician, normally that practice is who would be billing for this, because typically they're the gatekeeper of your healthcare, right? So they're supposed to be the ones that are kind of housing all of your information, making sure you're getting those preventative services done. So whether it be, eye exams, colonoscopies, mammograms, all of that kind of stuff, they typically keep track of that and try to help guide the patient with, or guide you with your healthcare. So usually that's who's going to bill for this service. But also patients switch, right? Patients switch providers. So if you have a patient coming to you and they're going to be new, you still want to make sure, do they have that benefit available, before seeing them or submitting the claim. So it is good to check on that. If they're scheduled for an annual wellness, it would be a good idea to check when you're checking their benefits that they haven't already used, they haven't already billed, out for that annual wellness within those 12 months so that you don't get that denial back. So the next question is typically, hey, what diagnosis code do I use? And so Medicare does not require you to use a specific diagnosis code, but a diagnosis code is needed. So you do need one with your procedure code. So you can choose any diagnosis that's consistent with the patient, but there's also some Z codes that may be appropriate. So Z00.00 is encounter for general adult medical examination without abnormal findings. So that may be appropriate. Or that same code, but ending in a 1 is if there are abnormal findings. So, of course, if there are abnormal findings, we would want to know what those findings are. And then you could also use any additional diagnosis that the patient has that was addressed or examined. So just don't forget, that should be within the documentation. I do recommend for patients that are seen by their primary care, I think that annual wellness visit for those that are involved in risk adjustment is a great opportunity for the physician to actually capture the chronic conditions of the patient. So I think that in risk adjustment, it's a great idea to actually have either the MD, DO, nurse practitioner, or physician's assistant see the patient, because they can fully address those chronic conditions and possibly update those diagnoses as applicable. Where if it's a nurse that's performing it, they cannot diagnose, right? So they're not going to be able to make certain updates and changes that may be needed or may be evident or obvious during that visit. And there's also the possibility that additional services may be needed during that visit. So, and patients that are risk adjustment eligible, that maybe have multiple chronic conditions, oftentimes need a deeper level service than just sort of the screenings and the basic wellness check. So I do recommend, I think that it's a great opportunity for, again, either the MD/DO, nurse practitioner, or physician's assistant to use that annual wellness to capture all of those chronic conditions and to try to get that higher level of specificity in there for those diagnoses to make sure that they're accurately reported for the year. There are some patients also that just do not like going to the doctor's office, do not like the visits. And so if they actually come in for the annual wellness, it's an opportunity to help them get all of their conditions kind of addressed and covered, get prescriptions written that maybe need refills and whatnot. So it is a perfect opportunity for that within risk adjustment. But again, you'd need that higher level provider to actually make any updates or changes to the diagnoses. So one of the additional services that is oftentimes reported is a depression screening. And typically we see the PHQ-9 being performed. And in order to be properly reimbursed and for the service to be supported, you should have the PHQ-9 form scanned into the record or have the results and the questions actually in the note itself. So some practices have almost like a little template area or where the software can have the patient fill out the information, but it becomes embedded in the note. And so the for Medicare, that depression screening is the G0444 code. And if that result is positive, or if they have a diagnosis, a specific mental health diagnosis, that can be used and attached to support that screening. Or there's this Z code, the Z1331, accounted for screening for depression. So this service, though, can only be billed with subsequent annual wellness visit. It is a component of the G0402 and the G0438. So for that initial physical exam and the initial annual wellness, the depression screening is included in those services. So you wouldn't report this separately. But for the subsequent annual wellness visits, so the G0439, you can add on the G0444 for separate payment. But again, another warning, not all Medicare administrative contractors will pay without a modifier separating it, such as 25 or 59. So you do want to make sure you know how to properly bill that for your area. It doesn't seem that it would really require that 25, but you'd be surprised. Some areas and some MACs do. It's sort of one of those oddball billing rules. It's sort of not one size fits all. So just a heads up there, make sure that you're getting that covered. But it is, again, included in that initial physical exam code, or the initial welcome to Medicare visit, right? And the initial annual wellness. So just with the G0439, you could add that on. Also, one other service is that advanced care planning I mentioned. And so there's a link here for another Medicare Learning Network article. It goes over advanced care planning, like very detailed. And so that's really good to check out if you're interested in potentially providing that service, or looking to see if maybe your practice, maybe you're a coder that's on here, maybe the practice is performing that, but you didn't know that there's a separate code for it. So it would be really good to check that out if you're unsure, you're unfamiliar with the advanced care planning. So it's a face-to-face conversation between a physician or other qualified healthcare professional and the patient to discuss their healthcare wishes and treatment if they become unable to communicate or make decisions. So the conversation and time spent must be documented in the annual wellness visit note. So that documentation really needs to be there, and be supportive of that conversation. And I always recommend, the amount of time that you're spending should also kind of reflect what you're saying you discussed. It shouldn't take forever to document, something. If it's only took, a few minutes, it shouldn't take a ton of documentation to kind of explain it. So just kind of be mindful of, what you should be including in there. I mean, certainly some form of macro and whatnot may be able to be implemented, but still add some specific information to that. Don't recommend just using any kind of macro there. Just, some patient-specific information should be added. So there's two different codes for it. So there's the 99497, which is the first 30 minutes. And so if it goes beyond that, then each additional 30 minutes is the 99498. So you would add, this is an add-on, you would add that on. And again, there's no specific diagnosis code. So you can use the annual wellness visit diagnosis code that you have for the G0438 or 39. And CMS, so Medicare, does waive the Part B deductible and coinsurance when performed on the same day by the same provider and billed on the same claim as the annual wellness. But you do need to append modifier 33. That modifier 33 can be tricky. That's something that I've noticed that most tend to forget about. It's sort of like in small print in the instructions that they give in the Medicare Learning Network articles and whatnot. So just keep your eye out for that. If you don't put modifier 33 on the advanced care planning code, they will apply the deductible, coinsurance, etc. So then the patient will call and say, I don't understand. I had an annual wellness visit. I'm not supposed to owe anything. I don't know why I have to pay this. So if you add the modifier 33, you will be able to avoid that. Of course, you can send a corrected claim after if you forget to put that on there. Also, you may provide this service outside of an annual wellness visit. And if that's the case, then they will not waive the copay, the deductible, coinsurance, or deductible and coinsurance, I should say. And again, it has to be the same provider, same day of service, and on the same claim as that annual wellness visit. Also, the social determinants of health is a new risk assessment that they've put out. So they put out information starting in January about that. We actually have a webinar on it on our website that goes over in detail the social determinants of health, kind of explains what it is, how you would go about filling out the risk assessment, and how you would bill for it. But it can be included with the annual wellness visit. So if you perform it at the same time, so some of the same rules apply as the advanced care planning. And honestly, it's a really big benefit to the patient for that screening to be done at the same time. So far, with the annual wellness visit, you could have the depression screening, advanced care planning, and now social determinants of health risk assessment. So for that social determinants of health, you would use G0136 for the administration of that risk assessment tool. Again, you would want to make sure that that tool is either scanned in or that there's some sort of a template in that note so you can show that documentation so that the risk assessment was actually performed, what the results are. If it's a negative result, then that no risk was identified and there's a Z code that can be used for encounter for screening for other disorder. Also, if there's a positive result, what was the result? So perhaps the patient has some kind of housing instability, or they may have homelessness or financial difficulties. There's different Z codes that you would use for those social determinants of health that you would add on to attach to that G0136. And so those diagnosis codes are in this range, the Z55 through Z65. So those are specifically related to social determinants of health. And CMS will start accepting claims for that social determinants of health risk assessment starting in July, so July 1st. They came up with a code and talked about it in January, but they said their systems would be updated and ready to go and ready to start accepting and paying for claims starting in July. So social determinants of health risk assessment, that's actually right around the corner. What are we? We're at the 18th of June. So right here in a little bit, you guys will be able to start adding those on. So if you haven't done so already, I'd say get your practice prepared for that social determinants of health risk assessment. And again, similar to the advanced care planning, if that's performed by the same provider on the same day, submitted on the same claim, and you attach modifier 33, they will waive the Part B deductible and coinsurance. But you can't forget that modifier 33. So there's also, again, that webinar that we have available on our website for social determinants of health if you need to learn more. It's a pretty fun webinar. That one we really enjoyed making. So there's also a really hot topic that all providers inevitably ask, and that is, what if I have a patient come in for the wellness visit, but I also go over like a bunch of additional stuff? Like, can I bill for an evaluation and management service also? You can if the documentation supports it. So something as simple as refilling medications does not support a separate and identifiable evaluation and management service on the same day as a wellness. So going over a patient's chronic conditions and supplying them with needed refills or referrals for preventative services and whatnot, that's all included in the annual wellness. That's supposed to occur. However, if a patient has a complaint where you have to go above and beyond, or there's a problem where you have to go above and beyond the typical, and you document that, and there's support for a significant and separately identifiable evaluation and management service, you can also bill for an additional E&M with modifier 25. So they actually give an example. So this is a Medicare example, and they say a patient comes in for their subsequent annual wellness visit, and during the blood pressure check, the provider notices that their blood pressure is elevated. After discussing this with the patient, the provider determines that the patient's hypertension is uncontrolled. The provider decides to increase the patient's hypertension medication and see them in 3 months for a follow-up. The provider documents the uncontrolled hypertension along with the medication changes. All other elements of the annual wellness visit are documented in the note as well. So this would support a significant, separately identifiable, and medically necessary evaluation and management service. And that's supported based on the fact that this patient has that chronic illness of hypertension that's in exacerbation, and medication management was provided where the medication actually had to be changed. And so that clearly supports a separate and identifiable E&M service. So we could code, for example, a 99214 with a 25 modifier with the hypertension diagnosis code I-10. And then the annual wellness visit, since it was subsequent, G0439, this was an abnormal finding, and the hypertension code. And then if the patient also had a depression screening done, since it's subsequent, you could apply that G0444. Did they have social determinants of health risk assessment? You may be able to apply that G code as well. And then if you go over advanced care planning and spend, a significant amount of time on that, you may be able to bill for that advanced care planning also. So there's a lot of services that could be added on when performing that annual wellness visit, in particular when it is a subsequent annual wellness visit. So again, that is a very common question, whether or not an E&M can be added on. And it really, truly is dependent on the documentation. Again, rule of thumb is if the medications are just simply refilled, that doesn't support anything extra. But if there's a chronic condition that requires some extra attention because there's an exacerbation, a change in medication is required, that's going to show support for something that's separate and identifiable. So we really would be able to attach, again, an additional E&M code. So I knew we were going to have a little bit of a less live crowd tonight, and I think that we went over this in pretty significant detail. And we plan to actually have another webinar full for annual wellness visits, which would include some more detailed information, but that webinar will take a little bit longer to go through than what we did now, and probably should be a little bit more structured. So we'll see if we can't get something up within the next couple of weeks or so for that, and have another webinar available for you guys. I know that many people took advantage. We have a modifier 25 webinar that's a zero cost. That's on our website. So again, you can go to stalkinghorsellc.com, and you could actually download the webinar there for modifier 25 at $0 cost. We have the social determinants of health webinar up there also. So you can just check out all the webinars we have up. And then on the YouTube channel, you'll also find that modifier 25 webinar is on there. So we try to do as much as we can with these webinars and making them as available and as at a reasonable cost as we do as good as we can with that. So hopefully you guys find that all helpful. Again, if you have any requests, send us an email at ttalk@stalkinghorsellc.com, and we will try to address that. I did actually get an interesting question earlier today about an add-on code. So I think we may either add another Tea Talk or add that topic on to next week. So we'll see. But also coming up, we are going to go over those depression screenings in a little bit more detail. So if you guys have any questions, feel free to post a comment. I don't see any comments yet, but you guys can feel free to do that even after the fact. It's always appreciated. But I think we're going to go ahead and cut tonight short. We're at about 40 minutes though, so it did take a little bit for us to get through these annual wellness visits. So appreciate you guys joining tonight. And again, make sure you submit any and all of your questions. We'll bring them up next week. So we will see you guys again next Tuesday. Thank you so much for joining. Just remember, you heard it straight from the horse's mouth. Have a great night, guys. See you next Tuesday.